The virus is spreading fast through Alberta, too, where there's been some reluctance to impose tighter restrictions. In a letter to Premier Jason Kenney, a group of doctors from across the province warns of catastrophic consequences to the healthcare system. They say hope is not a strategy, that what is needed is a short, sharp circuit breaker of lockdowns. Heather Yourex-West reports.
After last spring, the concept of shutting all but essential services is now familiar to Canadians. But this time, officials say in Manitoba, the lockdown won't last long.
The short, sharp set of restrictions to stop the spread of COVID-19 in Manitoba and to bring the entire province under the same restrictions.
It's known as a circuit breaker. The idea is that when COVID-19 is spreading exponentially through a community, a short period of lockdown can break chains of transmission, causing growth to slow. But it can't stop virus spread completely because essential businesses cannot close.
Certainly, an approach like this is not without possible harms. We also have to think about the potential negative economic and psychological ramifications of this.
We've seen other jurisdictions implement sweeping lockdowns, indiscriminately violating people's rights and destroying livelihoods. Nobody wants that to happen here in Alberta.
But while Alberta's premier continues to reject the idea, a growing number of the province's doctors are sounding the alarm.
If we don't do something, we will see death rates and refrigerator trucks in the front of our hospitals. And we have a narrow window to be able to deal with this. And we can deal with this if we shut things down for 2 weeks.
More than 70 Alberta emergency room and intensive care physicians sent a letter to the Alberta government Monday asking the province to consider the circuit breaker approach. Alberta's top doctor says the idea has not been ruled out.
When we're looking at all of our options, we know that there is no one perfect way to manage our COVID-19 experience. We need to look at all options on the table, including something like that circuit breaker.
With stakes so high, it's a last resort kind of measure. Question is, with daily case counts on the rise, how long do you wait? Heather Yourex-West, Global News, Calgary.